Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all.
Hello, listeners, and welcome back to the Heart of Healthcare podcast. I'm Steve Krause, and today I'm interviewing one of the living legends in healthcare, Glen Tullman. Glen is currently the founder and CEO of Transcarent. Prior to Transcarent, he founded and led Livongo, one of the pioneering companies in the digital health space, taking Livongo all the way to an IPO and ultimately an $18 billion acquisition by Teladoc. Glen has also served as CEO of two other successful healthcare companies, Allscripts and Enterprise Systems. So now you can see why I call him a living legend. So I want to start off. You've been in healthcare, don't mean to date you, but I think close to 40 years now. And I'm curious, what's the single biggest change in healthcare that you've seen in your career?
Well, I've been fortunate to see a number of changes. You and I have been around for a while, and so we saw electronic prescribing come along. That was a really important thing because it saved a lot of lives. People don't remember, but docs used to be wed to their little script pads, and we made fun of their handwriting, but it wasn't actually funny because people were dying from things like that. And so that was a big change. Then came electronic health records. That was another seminal change. I don't think we've seen as much of the progress as we wanted to. However, they were a necessary but not sufficient condition to improving healthcare because we had to get all the information digitized. And now we're off to what I believe is going to be the next big step in terms of improving the health and care of the population. And that's using generative AI and some of the other technology to actually turn healthcare into a consumer-directed industry like the rest of the industries that we see.
Let's touch upon the electronic medical records. And we were fortunate at Bessemer to work with one of your companies that you were CEO of, Allscripts. You mentioned you don't think we've made as much progress as maybe you had hoped or others hoped even on the electronic medical record front. Why do you think that is?
I think the biggest missing piece, maybe there's two. One is interoperability. And that is, we were fortunate to benefit, as others in the industry were, from the government putting $20 billion of funding into electronic health records to accelerate the adoption. What was missing from that was a requirement that the records become interoperable. And not having that means that even today, years later, even in some cases on the same systems, that if you go into one hospital and you go into another hospital, those electronic health records don't connect. That's both a safety issue and a cost issue, because you may see situations where the same test is being run 2 or 3 times. You may see situations where information that's critical to someone's survival or health is not being shared. So that's one missing piece. And I think the second missing piece that was not realized was making the electronic health records both consumer friendly, but also physician friendly. So they have not actually made physicians more efficient or more effective. And that was part of the goal that we were working on when I was at Allscripts. And that was finishing the job. And finishing the job meant that when a physician or a caregiver would use an electronic health record, it would not only make them faster, but also smarter about the individuals they were dealing with.
I want to backtrack a little bit to younger Glen, and I've done a little research on your family. You're a very entrepreneurial family. And also, as I referenced, I mean, you've probably been one of the most successful entrepreneurs in healthcare. Like, what was in the water at the Tullman family? Did you know you were going to be an entrepreneur? Did you think you were going to be in healthcare?
I give a lot of credit to my mother, who basically never said no about anything we wanted to do. So she would sometimes use distraction, but pretty much anything you wanted to try or do, she would encourage you to do it. And there was no real judgment about failure. It was all about learning. So when I was very young, maybe 10 or 11, she let me climb up on the roof, cut a hole in the roof of our family home. Now you remember, this is a 10 or 11-year-old on the roof using a saw to cut a hole in the roof to build a solar array on the roof. And the roof was, to this day, the roof probably still leaks. It didn't exactly work very well. Then I tried to wire it into our electrical system, which shorted out the house. None of that actually, and then I moved on to the next project. And so that kind of thing, and, happened a lot at the house. On the flip side of that there was an incredible focus on results. And I often have told the story about, I was the youngest of 6 children. And my mother, when you walked into the house, there was a picture of each of the kids at the top of the steps. And if you hadn't done something well, she would turn the picture around. And so, of course, everyone who walked in would say, why was Steve's picture turned around? And she would tell the story. Well, he got a B in this course, or he didn't do this very well, so there was no question that everything was being measured. So it was that combination of a willingness to experiment and try things with this sense of, results matter, and everybody doesn't get a trophy, not in this house.
Tell me, how did you get into healthcare, Glenn?
Well, the healthcare experience was an interesting one. That really came from a combination of things. I think there was an entry into healthcare, which was just about using technology to improve business processes. And then there was a real commitment to healthcare, which came in part when my youngest son, Sam, was diagnosed with type 1 diabetes, and he was 8 years old. And, when I saw how fundamentally broken the healthcare system was for people who all they wanted to do was stay healthy, I realized that this was an opportune time to enter the industry. And then I had gone to see a professor, and this was after taking enterprise systems public. And, I had kind of vowed not to go back to my alma mater until I had done something that was a worthy accomplishment. And they invited me back to speak as an entrepreneur. I felt very good about that. But that night I went to see a mentor of mine, a close friend. He subsequently passed away. And he asked me how I thought I was doing. And I said, well, I think I'm doing pretty well. Took this company public, made some money, have some recognition. And the company's a good company. It's doing important stuff. It's actually did a lot of the checklist management for operating room scheduling systems that Atul Gawande later wrote a book about called The Checklist Manifesto. And but this professor said, how do you think you're doing? And I said, well, I think I'm doing pretty well. And he challenged me, and he said, well, we didn't educate you to make money. We educated you to make a difference. And I don't see it happening. And it was a real wake-up call for me. And ultimately, at that point, I said, I want to commit myself to work in companies that are really going to make a difference. And that really led to both Livongo and subsequently to Transcarent.
You're now a veteran grizzly digital health entrepreneur, luminary. But back at Enterprise Systems Day, I believe that was your first CEO-ship role in healthcare. And I'm curious, as you look back, what would you tell younger Glenn, CEO?
1, I would have taken more risks. 2, I would have moved faster to make sure you have the right people. And 3, what I would say is you ought to do things that matter, and you ought to build companies where if you win, you actually win big. Because the worst thing to happen is you accomplish your goal and it's not meaningful. And so, at Livongo, even today, as I look back, every day there's 1 million people who wake up and they're healthier and happier because they're using Livongo. And that's an accomplishment. When we look back at Allscripts, and we look at electronic prescribing. When I left, I think there were 700 million electronic prescriptions being written more safely, more effectively, more efficiently because of what we were able to do there, taking it to scale. But we took it to scale.
And you were at all. I mean, you've made a lot of difference in both those companies for sure. You were at Allscripts very early on in the healthcare IT world days, right? And share the. I mean, it was such a different world back then. I share some insights on that.
There was one little quip I want to tell you about. You said when we started, it was the very earliest days of bringing digital, and it wasn't even digital then, just bringing automation to healthcare. We sent out a setup to an office once, and we would then go on site to set them up. And they called and they said, hey, we went ahead and set everything up. And the only question we have is the cord for the foot pedal is not long enough to reach the floor. And of course, and some of your users won't even understand this, but it wasn't a foot pedal. It was a mouse at the time.
It's amazing.
The mouse
story.
was attached to the keyboard. That's what, and second, there was no wireless network. So you had to literally hardwire these things and run the cord. We had people crawling through ceilings. I mean, those were crazy, crazy times. And then when you did get wireless, it wouldn't work because many of the office walls were too thick. So those were the challenges at the time that we dealt with.
You were there for 15 years, I believe. Can you tell the listeners, it started off as a e-prescribing company, but ultimately became an EMR. How did you make that transition? How did that happen? And share it was such a different world back then.
Well, it actually started as a medication dispensing
that's when we first
company.
invested.
And it's funny because it's a little bit of back to the future. And that is, today we've gone back to that same model in some respects. But the idea was that you would give physicians at their offices the most commonly used medications. And when they prescribed something to you, Steve, they could actually then hand it to you right there at the office. That meant you didn't have to go and pick it up. If you had any questions about it, you could ask the prescribing physician. And it was actually a much better model. So that's the company that I arrived at. It was a Series J preferred. Now, for your listeners who don't know what that means, and I didn't know what it meant at the time, what happens is you go out and raise money and you start a company, and then you run out of that money. So you go to people, and you and I have done this many times, Steve, and you say, you're going to be more preferred than those first people who put in their money. You're going to be a Series A preferred. And then you run out of that money and you go to people, you're going to say, you're going to be more preferred than the first people and the Series A.
You don't want to get to you don't want to get to J.
I had never heard of it. And there's a Harvard Business School case written about Allscripts. And it quotes me as saying, I didn't know there was such thing as a Series J preferred. And that was really a true quote. And so we arrived, the company was out of money. We bought about 60% of the company for $6 million, and 2 years later took it public for over $1 billion. So it was a great financial return. But what we did was we pivoted, and I said this medication dispensing, they had initially called us and they had initially said, well, you have this technology background, could you use that to help us automate this process? What we figured out was in automating the process, we were essentially having to do things that could transition the company. And so, from that standpoint, that's how we moved from delivering medications to offices to electronic prescribing. Once we got to electronic prescribing, then physicians said, well, if I'm going to have this device in my hand, can I also dictate into it? So we became kind of a stealth, what was then called an electronic medical record. Then part of what we did was we burned the ships behind us. We basically said, there is no going back.
We'll be back after the break.
This season, Instacart has your back to school. As in, they've got your back to school lunch favorites, like snack packs and fresh fruit. And they've got your back to school supplies, like backpacks, binders, and pencils. And they've got your back when your kid casually tells you they have a huge school project due tomorrow. Let's face it, we were all that kid. So first call your parents to say I'm sorry, and then download the Instacart app to get delivery in as fast as 30 minutes all school year long. Get a $0 delivery fee for your first 3 orders while supplies last. Minimum $10 per order. Additional terms apply.
I have a question for you. You took 2 years off, I believe, from being, your CEO-ship at Allscripts to, starting Livongo, and you started a venture firm, which we've worked with at Bessemer. Love you and your partners there. I'm curious, did you think you were going to be a career VC? Did you have the entrepreneurial itch? Tell me about those 2 years and kind of how that felt.
Yeah, well, I've been very blessed in my career to have a long-term business partner in Lee Shapiro. And Lee and I, met when we were very young. We've worked together ever since. We do almost every investment we make together. And when we started the firm, it was not because we wanted to start a firm. It was because when we started in companies, when we made investments, we would bring along friends and family. And some of them started to say, because we were lucky enough to have some great returns, they said, Glenn, anything that you and Lee do, we're going to invest in. So coming to us and give us separate business plans makes no sense. We'll just give you a chunk of money. And whatever you're going to invest in, we'll invest in. We don't even need to see it. And that sounds like a fund. And as those numbers started to grow, we had to put our own capital somewhere. And people said, rather than doing a separate agreement for every company, you should just do a fund. At that point, we added Robert Garber. And Robert brought to us not only entrepreneurial experience, but he had worked in funds more than Lee and I had. So he helped us organize that. And then, as you mentioned, eventually added Alyssa as our fourth partner in the fund. And that's grown substantially. We've been fortunate to have great returns because of some of our winning companies. But I think also our whole thesis at the firm was the informed, connected health consumer. The idea was we want to invest in companies that make people more informed about their healthcare or smarter about their healthcare. We want to invest in companies that not only make people more connected to the internet, but the internet connected to them, hence remote monitoring. We want to focus on companies that turn people into health consumers, not patients. And last but not least, focusing on health and not health care. That is, how do we keep people outside the 4 walls of the hospital, potentially at home or somewhere else, as opposed to having to go to the hospital for everything. So informed, connected health consumer, that's been a very tight thesis for us in terms of investing. That's number one. And then the second thing is, we always tell people, if you don't want help running your business, don't come to us because we can't help ourselves. And we get very involved in these businesses. And so for the right kind of entrepreneur, they love it because we roll our sleeves up. And, every Saturday morning, I think for the last 20 years, I meet with companies and Lee does the same thing. And, we're spending hours of time. Most of them are in our portfolio, some are not. And we love business. We love to build businesses. And so that's what we do.
Let's talk about Livongo for a few minutes. Did you come to Livongo as an entrepreneur or as an investor?
A little bit of all of the above. So one, I wanted to solve the problems in diabetes. Our foundation is one of the largest funders of research to find a cure for diabetes and keep people healthy until we do. We put a lot of money into continuous glucose monitor, which today is second nature. Lots of people have them. When we did it, it was really questionable whether you could even do that years ago. So I wanted to be in that space. I was approached by an entrepreneur who created essentially the Livongo meter, kind of a crazy mad scientist, brilliant guy. And Kim, again, brilliant. And he approached me and he said, Glenn, I'd like you to not only invest in this, I want you to be a part of the company. And I said, Tim, I don't know. And the more I saw his brilliance about what he had invented and done so in a great entrepreneurial story, kind of on a credit card and doing crazy stuff to finance it. But what he had invented was really unique. And he came and said, look, not only put your money in, but I want you to come and run the company.
I'm curious, what people know the Livongo story. It's the paradigm of success. What's one thing that people don't know about Livongo that you could share?
Well, there it is. Everything worked and you don't always get that benefit. I mean, we created an experience that people didn't just like, that they actually loved. We're able to prove that we improved care. And because we had their day 1 blood sugar level and day 30 and day 90 and a year later, and it got better. And lastly, we were able to cut the cost pretty dramatically. I think one thing they don't understand is the level of culture and commitment we had there. Almost a third of the people either had diabetes themselves or had a family member who did. So the level of commitment was extraordinary. And on top of that, we had a requirement. And the requirement was that everybody in the company had to take a needle and prick their finger, draw blood, and actually use the meter. And some people said, hey, that's an interesting thing, but I'm not going to prick it hurts. And I'm surely not going to do it regularly. And so I said, no, that's a requirement. And, we had some people who left. People said, look, I'm a developer. I don't need to do that. No, everybody needs to do that. This is what our customers do. Thank God you don't have to do it 10 times a day for the rest of your life. But I want people to understand that experience. I want them to use the meter.
Let's focus on Transcarent now, your next company, the one you're currently working on. I agree. It's a little bit of a mystery. It has been to people in the industry, what Glen's up to. I've been doing it for a while now. Why start Transcarent? What was missing in the industry in your mind that led you to start Transcarent?
First of all, that's the most common question, which was, why in the world would you do this? Why would you start over? And some people have gone further and said, Glen, you ended at the highest point that anybody could end at, largest digital transaction in history in this space, great outcome, et cetera, et cetera. And and people have said to me, you're remembered by the last thing you do. So why wouldn't you stop then? And the answer was pretty simple. And that is, one, we haven't solved the problem in healthcare. And that was number one. Number two, I wake up every day and I need something to do. And I love to build businesses if that's all I was doing. I love to operate things. But I wanted to solve, my parents taught me that, to whom much is given, much is expected. And look, you and I, we were lucky enough to have educations. We're in this country. We have all these advantages. And, it's our responsibility to use them. And there is no bigger problem or no more important problem than healthcare in this country. We can't be successful as a country. We can't be competitive, our businesses, unless we address healthcare. And it is fundamentally broken right now. After 20 plus years of working in healthcare, more than 20 years, if you survey people today, what they say is healthcare is more confusing, more complex, more costly than ever before, and it's getting worse, not better, after all of our work, Steve. So I wanted to go after the biggest problem that there was, and that was, how do we create an experience that people actually will love with their healthcare? How do we make it as easy in healthcare as it is in every other industry? And it's funny, when I started Livongo, I moved out to Silicon Valley, to Mountain View. And I did that because people said it's different. And one thing I learned was, in healthcare, we try to force people to do the right thing. We try to bribe them to do the right thing. And in every other industry, we just build really great apps that people want to use, and they understand the value intuitively.
I know you're trying to bring the consumer into healthcare, and I totally agree, by the way. We've made a lot of progress on digitizing the industry. We've made progress on trying to move to value. The one thing we haven't uncracked is actually bringing the consumer into the healthcare experience. And it's not that it hasn't been tried before. So what I'm trying to understand is, how does Transcarent solve that? Like, what is missing? Like, what's the unlock that makes it Uber?
So what we have today is, if you're an employer, you went to a large payer and you said, solve my problem. And along the way, people said, well, in diabetes and mental health and reproductive and all these areas, it wasn't getting done. So then you had all these point solutions come along. And so now there's point solution fatigue, but more important than that, there's consumer confusion. And there's multiple sources to go to get your care, and nobody shares information. So the experience is, as I said, it's confusing, it's complex, it's costly. That's the consumer experience today. So then, instead of solving that problem, what we do in healthcare is we create yet another place to go, and that's called a navigator. So we create a whole industry called navigators, and they're supposed to not solve the problem, but help you sort through it. Navigators have fundamentally added no value. They've added a cost. They've added another step. So imagine if you needed to use Google or Uber, but before you used it, you had to call somebody else every time to tell you how to use it. Like, that's crazy. So we created these navigators, and it doesn't help consumers, because if you're going to say, I call you and you're the navigator, and I say, well, it turns out I hurt my knee, and you say, the right thing for you, Glenn, is you should go to Sword, or you should go to Hinge. And that's a digital, solution for MSK. And so what do I do as the navigator? I give you their number. I give you their website. Now you go and you start over. Terrible experience. That's the best they can do today. So what did we create yesterday? What did we announce? What we announced was something called wayfinding. It's the next generation after navigation, but it would be the equivalent of if you were using a flip phone, which does one thing, and you move to an iPhone, which does everything. That's how big a shift it is. So we combined three things. The first thing was navigation of your benefits, benefit navigation. Today, that's a whole separate space. And people every day ask a simple question. Is this covered by my plan? How do I pay for this? Second, clinical guidance. What do I actually do? Should I go to a doctor? Should I get surgery? Should I not get surgery? And then last but not least, care delivery, actually delivering the care. All of those now are in one app, one place. And our vision at Transcarent is one place for all of your health and care. It's now all in one place. And we've added to that every possible point solution you want. We'll put on our platform at no charge. Now, here's where it gets really interesting. We're doing that at half of the cost or less of what a navigator costs today. $5, full stop. And we include in that $5 virtual care.
That's great.
So your telehealth. Now, when I talk to some of our clients, the folks at Boeing, the folks at Target, these are people the folks at UPS, these folks aren't sitting in front of a computer all day. So the idea to have all their health and care in one place on their phone, that's revolutionary. Now, all of a sudden, we built Amazon for healthcare because Jeff Bezos did it. He did it for everything else.
Yeah, no, I agree. I've always said that that first page,
and that's what we did.
That first page of your iPhone is the most valuable real estate in the world. And it's amazing that the most expensive part of the economy doesn't have a place on that iPhone. And so now I understand better what you're trying to do at Transcarent, which is own that space and have that consumer-like experience that's so lacking in our industry. So it's really exciting what you're doing at Transcarent, Glenn. And I appreciate you coming on and sharing not only your career journey, which is amazing, but also kind of what you're up to next, because it is the holy grail that's been not fulfilled to date.
Well, thanks for spending the time. Thanks for all you do in funding a lot of innovation across healthcare. And we'll be excited to keep you posted on our progress. But I think this is a transformational time in healthcare. And, with machine learning, with generative AI, we're going to have an opportunity to do things we've never been able to do before. And Transcarent's excited to lead the way.
Totally agreed. Super fun times. All right, my friend, thanks for coming on. Appreciate it.
Thank you.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and Steve Krause. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and episode details.
You've worked hard to build your brand, so why settle for one-size-fits-all branded clothing? Lands' End Outfitters creates apparel your employees will truly want to wear, all backed by above and beyond expertise. See why Lands' End Outfitters has been a branded apparel supplier to some of the world's most respected brands for more than 30 years. Go to business.landsend.com/pod20 and use code POD20 for 20% off your first product. That's business.landsend.com/pod20, code POD20 for 20% off your first product.